السلام عليكم ورحمة الله. محاضرتنا لهذا اليوم بعنوان Patient Management. Gagging reflex. How we can manage the gag reflex that occur with dental patient. We should driving patient concentration away from gagging reflex. In intraoral film, try to decrease the film staying in the mouth by decrease exposure time and increase exposure factor. Use extraoral film and use topical anesthesia. Number 2, mental disability like epilepsy, cerebral palsy, autism, mental retardation. We can use mild sedation and extraoral film are used. During X-ray procedure, using extraoral film, decrease exposure time and increase kilovolt peak. 3. Physical disability. Vision impairment. Using a clear verbal explanation to inform the patient about the procedure. Hearing impairment. Using a clear written instruction or acting sign. Mobility impairment. If the patient uses a wheelchair, assist the patient to transfer from his chair. If the patient cannot use the upper limbs, film holder is used. 3. Child patient. Use a small intraoral film, lead apron, reduce exposure factors, and use extraoral film instead of intraoral. Adjust film exposure and processing to avoid second exposure to X-ray. This is the film holder that used to children, and this is the lead apron. X-ray protection is highly recommended for individuals who may be exposed to X radiation. Include both patient and operator that exposed to X-ray that penetrate the body and absorbed by bone, organs, and tissues. Follow ALARA. That means keep exposure as low as reasonable achievable. Radiographs should only be taken at minimum dose with reasonable information. So the benefit from radiograph should be weighed against radiation dose and then decide to take radiograph or not. Operator protection. Avoid hold the X-ray tube or film during exposure. Never stand at the path of primary beam. Barrier stands behind lead barrier about 2 mm and look to the patient through a leaded glass during exposure. This is the lead apron and this is the position of operator with patient position. Stand minimum 6 feet away from the X-ray beam behind the patient head at angle ranged from 90 to 135 degrees during exposure. This is the proper position of the operator at angle ranged between 90 to 1035 degrees with distance about 6 feet and behind the patient head. Film badge is a blue plastic frame containing a variety of metal filters and a small radiographic film which exposed to X-ray. It provides a permanent record for the dose received by operator, radiographer, and dentist, and it used for 1 to 3 months before being processed for monitoring of those received by operator. This is the film badge. Patient protection. Necessary X-ray. Number, frequency, and type of radiograph should be adjusted. Filtration and collimation. High-speed film. Low exposure time. Minimum object film distance and maximum film source distance. Adjust film exposure and film processing technique to avoid retake of X-ray. This is the lead apron and thyroid collar. This diagram shows different sizes of X-ray beam. The first one shows large round X-ray and large exposed area. The middle one shows small round X-ray beam used with large exposed area also. The third one shows small rectangular X-ray beam with a small exposed area. Protection to public. Warning, informative signal to indicate hazardous radiation. Patient should sit away from X-ray room, full lidded of X-ray room. Patients are not allowed to wait in the corridor next to X-ray room. Biological effect of radiation. Types of radiation. Non-ionizing radiation, that means radiation that doesn't have sufficient energy to dislodge orbital electrons, such as microwave, ultraviolet light, lasers, radio wave, infrared, and radar. Ionizing radiation means the radiation that has sufficient energy to dislodge orbital electron, such as alpha particle, beta particle, neutron, gamma ray, and X-ray. All the atoms in a human body has electrical stability. When X-ray photons strike a negative electron in the atom of living subject tissues, it displaces the electron, leaving the atom electrically unbalanced. So, the atom ionizes, such process called ionization. The ionized atom has a strong tendency to seek its stability by accepting a negative electron from somewhere else, and by doing so a new chemical is formed, and the cell of which the atom and molecule are parts can be altered, so that the basic effect of ionization are molecular alteration and creation of new chemicals. Radiation biology is the study of the effect of ionizing radiation on living systems. The initial interaction between ionizing radiation and matter occurs at the level of the electron within the first 10 to 13 seconds after exposure. These changes result in modification of biological molecules within seconds to hour. In turn, the molecular change may lead to alteration in cells and organisms that persist for hours, decades, and possibly even generations. That may result in injury or death of the cell or organism. Effects of ionizing radiation. Radiation acts on living systems through direct and indirect effect. Direct effect, when the energy of the photon or secondary electron ionize biological macromolecules, the effect is termed direct. Those effects occurred in a specific area of the body. They were all exposed cells in this area are altered directly by ionizing process, and death occurred at the time of mitotic cell division. Indirect effect, it happened in several ways, where new chemical result from a process of ionization are incompatible with body tissues. Example, when photon absorbed by water in an organism, ionizing the water molecule, the resulting ion form free radicals, radiolysis of water, that in turn interact with and produce changes in the biological molecule. Because intermediate changes involving water molecules are required. So, conversion of water to H2O2 peroxide, which cause cellular dysfunction. Also, X radiation can alter the chemical composition of hormones, enzymes, and other body secretions, make them partially or totally ineffective. Such indirect effects depend on the amount of exposure to X-ray. This series of events is termed indirect. Radiosensitivity of tissues and organs. The radiosensitivity of the tissue or organ is measured by its response to irradiation. A fairly small number of lost cells result in no clinical effect, with an increased number of lost cells or affected organisms display a clinical result. The severity of this change depends on the dose and the amount of cell loss. Moderate doses to a localized area may lead to repairable damage. Comparable doses to the whole organism may result in death from damage to the most sensitive systems in the body. Body tissues differ in their susceptibility to undifferentiating radiation. Cells are most sensitive to radiation when they are immature, undifferentiated, and rapidly dividing. As cells mature and become specialized, they are less sensitive to radiation. If cells are more oxygenated, they are more susceptible to radiation damage, which is known as oxygen enhancement ratio. The following tissue and organs are listed in order to their susceptibility to X-ray. High ratio sensitivity, such as lymphoid organs, blood-forming tissue, bone marrow, intestine, stem cell, lymphocyte, and reproductive cells. Intermediate radio sensitivity, young or growing bone, growing cartilage, glandular tissue, salivary glands, kidney, liver, lung, and epithelium of alimentary canal. Low radiosensitivity, skin, muscle, and optic lens. The least effect seen in nerve tissue and adult bone. Short-term effects of radiation on tissue seen in the first day or weeks after exposure, while long-term effects seen month and year after exposure. The response of cells, tissue, and organs to irradiation depend on exposure condition and the cell environment. These modifying factors include Dose. The severity of deterministic damage seen in irradiated tissue or organs depend on the amount of radiation received. All individuals receiving doses above the threshold level show damage in proportion to the dose. Dose rate. The term indicates the rate of exposure. For example, a total dose of 5 gray may be given at high dose rate 5 gray per minute or low dose rate 5 milligray per minute. Exposure of biologic system to a given dose at high dose rate causes more damage than exposure to the same total dose given at lower dose rate. Oxygen. The radioresistance of many biological systems increased by factor of 2 or 3 when irradiated in contact with reduced oxygen. Hypoxia. The greater cell damage sustained in the presence of oxygen is related to the increased amount of hydrogen peroxide and hydroxyperoxyl free radicals. Both peroxyl radicals and hydrogen peroxide are oxidizing agents that can significantly alter biological molecules and cause cell destruction. They are considered to be major toxins produced in the tissue by ionizing radiation. Latent period is the period of time interposed between exposure and clinical symptom. Such period varies with the dose. So, the more is severe dose, the shorter the latent period. Sometimes the latent period is as long as 25 years for some minimal doses. Thank you for your listening.